Hey, how are you?
I'm good. Here's a little treat.
Oh, thank you.
Okay.
Anybody want a cookie?
No, I'm good, thank you.
No.
They look delicious. Thank you very much.
Oh, you're welcome. Welcome. Enjoy.
Thanks.
Y'all have a good day.
My name is June Geis, and my age is 80 years old. Yes, I started with pain for about going on for 6 months in my back, and the nerve pain down my left leg was really bad all the way to my feet, and I was really in a lot of misery. I was recommended I go to the pain center, and I did have injections between the 3rd and the 4th and the 5th and 6th areas. I had 2 shots each time for I think it was 2 months, and then that was effective at first, and then the effect of the injections wore off and I was back to pain again. And then it was suggested I start physical therapy, which is what I did, but the pain continued. I still have a lot of nerve pain. And I was placed on the nerve medication, which did help, but it was not solving the problem. And then it was recommended I see Dr. Smith, and I saw Dr. Smith, and I had an MRI, and then he showed me the MRI that I had back in 2013, and then the present MRI, and showed me the disc. It was a bulging disc, and what he could do to alleviate that problem, and with the new technology. And I must say, new technology is advanced greatly. We can do so much more. And so I went through surgery, I should say, a couple of weeks ago. And the modern way of doing things is so quick. He went in, my anesthesia, I was leery about that because I thought I would be intubated, and no, I just had the mask and an IV. Had my surgery. Next, I was in my room, and the nurses were there on a routine basis, constant, checking me, and then I was able to get up and walk. And the other thing is a new technology with, you always have to go to the bathroom. Well, now they have it so that you just place a tube between your legs, and the urine is sucked to the suction machine, just like you'd had an NG tube down, and the contents of your stomach went to the tube, to the area on the wall, and this way is the urine that goes to suction. And that is a most marvelous invention I've ever seen. That helped me a lot. I didn't have to get up and move every time I turned around because I had an IV in. And medications were routine, right on the money, and I was comfortable. And so I said, because of my age, I stayed overnight, and I was able to go home the next day and be in my own home, and had all the tools. And the other thing that was really great, I forgot the lady's name, but she gave me all the tools I would need to pick things up off of the floor because June could not bend forward. And also putting on your socks. I think that's the most marvelous things. You put the sock on the long tube with 2 cords, and then you wiggle your foot in there, you pull the 2 cords, and here's your sock on your foot. Wonderful. And so that helped a lot since I couldn't bend over forward. And then just to get up and start moving, and you'll find yourself sitting there and say, well, you better move. So you get up out of your chair, because my butt would get numb, and it would tell me, you need to move. So I got up and I'd move around, and now I've been able to get outside and walk around, and I try and do that at least 2 times a day now. I wouldn't be hesitant because the technology is advanced way beyond what I've experienced when I was younger. because it used to be a long incision. It took longer to heal. This way, your surgery is quick, done, you're home, you're starting to heal. It does take time. Don't be fooled that it will take just a little while. Internally, you still are going to heal. You have to give yourself the time. And you don't want to overdo, but you don't want to underdo either. Did a marvelous job. They were there, they explained everything. I'm used to have somebody tell me exactly what I want done, what's going to happen, and the follow through. And they were very good at that. I had that from the time I went in to register for the surgery. We were going in to be prepped for the surgery, that I have my IV. The anesthesiologist came and explained everything. And then going to the operating room, and I must say, I saw the operating room, I saw the table, but then they gave me the anesthesia and I don't remember anything. My nurse on the floor, she was wonderful. She was right on there. I mean, I didn't have to use the call bell because she was there. She routinely gave me my routine meds that I was to have, checked my IV, and my aide was there, and she came in and did all the vital signs and everything. The routine necessary things, and that was wonderful. Yeah, that was a very good experience. Oh, Dr. Smith, he was wonderful. He's direct and to the point, and I appreciate that. I want to know what to expect, what I'm going to have done. And he was able to take his iPad, show me the spine and the disc, and explain what he had to do. And it was great. Yeah, yes, he did a wonderful job. I appreciate the new technology in his service. Mm-hmm.